Let's talk school refusal. What is it? It's really any reason that a child would be avoidant of attending school. Sometimes it's fear-based, sometimes it's symptom-based, like there's chronic pain. So what might this look like? This could be children who tantrum before going to school, start panicking the night before, spend excessive time in the nurse's office at school or a counselor's office, any kind of fear of being in school where they feel uncomfortable, and they're showing behaviors associated with that fear at home and or in school. It's important to differentiate though that school avoidance is not the same as truancy. Truancy is what we think of like playing hooky, going to hang with your friends at the mall. This is not that. These are children who generally want to be in school or enjoyed being in school prior, but they don't feel like they can attend school. Now, sometimes you'll notice this happening gradually where your child has trouble kind of getting there in the morning, starts to be late, starts to have anxiety the night before. It doesn't usually come out of nowhere, although there are some cases where there's a sudden traumatic event, an extreme bullying incident or school shooting where the child will react in intense fear. The tricky thing about school refusal is that it affects children with a wide range of diagnoses. So school refusal in itself is not a diagnosis. It could be a child who has significant social anxiety and struggles with public speaking, or has a stutter, or has a panic attack when they have to get in front of the classroom. It could be a child who has a significant fear of illness or has emetophobia, where they fear someone getting sick or vomiting inside their classroom. It could also be a child who's neurodivergent, who has autism and ADHD, who has sensory aversions and can no longer tolerate being in the school setting. Whatever the reason, whatever the cause, there is some kind of fight or flight that is happening within the body that is causing the child to feel that the only thing they can do in the moment is to escape, to find safety, which makes them feel better in the short term, but reinforces the avoidance and the refusal in the long term. Now, the good news is there's many things that have been found to be effective to help with school refusal. The complicated part is it really depends on the specific child and the specific circumstances. So as I mentioned, there's these wide range of diagnoses, wide range of presentations. So there is research to support a lot of therapies and interventions, but it kind of depends on what's maintaining this avoidance. So for a lot of children, CBT, cognitive behavioral therapy, has been effective, sometimes in combination with mindfulness, sometimes exposure therapy or exposure and response prevention if it's more OCD or phobia based. Sometimes you need medication along with therapy, especially for kids who have reversed days and nights. They have like the nocturnal sleep schedule, and that's really playing a role. There can be interventions specific to the insomnia. Some families will benefit from family therapy and dialectical behavioral therapy, or DBT, if there's more family discord. So here's some advice for parents, and this is a no blame game on parents or children. We're all in this together, and that's really the message you want to reinforce to your child. It's not me versus you. It's not me making you, forcing you. It's we're getting through this together. So you don't want to put guilt on them. You don't want to put shame on them, but you do want to hold firm to what you expect of them, which again depends on the case. If they're severely ill, then, they might not be able to attend school for a day, a week, whatever it might be. If they're having severe pain, whether it's somatic based or not, meaning is it coming from anxiety and stress, or is it a more medical problem? Whatever it is, it doesn't matter. If your child is significantly unwell, then they're significantly unwell. If it seems like they're unsure about whether they want to go to school and you feel like they can handle it, you feel like it's anxiety that they can overcome, and you've been working on a reintegration plan, then you want to gently encourage them to return. This might look like, okay, I'm not going to force you to go to school today, but I am going to ask you to try. And what that might look like is I'm going to ask you to get dressed, because either way we have to get dressed for the day. And I'd like you to get in the car, and we're going to drive to your school campus. We're going to sit in the parking lot, and we're going to reassess, and we're going to see how you feel. And if you feel like you can go into school for a little bit, whether it's late or you leave early, that's fine, as long as that's progress. And if you feel like you're absolutely at a 10, acute anxiety, stuck in fight or flight, paralyzed by fear, then, we're going to take a mental health day. We're going to figure out how we can best support you. And, we won't go to school today. For many children, it might be helpful to get a psychiatric or neuropsychological evaluation to understand what's maintaining this avoidance. Is it anxiety, undiagnosed learning disability? Is it an undiagnosed neurodivergence? What the research really stresses, and this is so important, and I know it is challenging, the collaboration between home and school is essential for the child to be successful. It is really important that the information is shared between the school team, the clinical team, the parents, that everyone is on the same page as much as you can be. In fact, the research shows when the parents themselves are not on the same page, or the parents in the school are not on the same page, there's significantly longer returns to school, if at all. So if you're a parent and you're concerned and you feel like your child's starting to become school avoidant, don't wait. Call an IEP meeting as soon as possible. You can call one at any time and express your concerns to the staff. Get an idea of what they're seeing or not, and what supports might the child need. Do they need an IEP? Do they need modifications for their day, accommodations in the classroom, a special placement, special services? How can we support this child? There have been some schools that have school refusal programs or school attendance teams, and there's significant benefit to these programs. So the more schools that are able to integrate this, the better. Also, homebound instruction and homeschooling can be options for children who are in acute distress or acute pain or discomfort. However, you want to make sure there's a social component and that they're not further avoiding their fears. And finally, the School Avoidance Alliance and the International Network of School Attendants are great resources for parents.